Hey everyone, this is Derek with Orthopedic Physical Therapy Products. Thank you so much for joining us for this next level episode as part of our content series with EIM Evidence in Motion. Now, today we have Jen Stone with us, and we're going to be talking about pelvic health, and that's very fitting this month being Women's Health Month and Pelvic Pain Awareness Month. So again, this content series is meant to really dive into these subtopics under the PT umbrella. Again, this is Pelvic Health Month. We're going to be talking about pelvic health today and trying to highlight, why as a clinician investing some of your time into this category can not only help you progress your career, but also take your quality of patient care to the next level. So, Jen, thank you so much for joining us today.
Absolutely. I'm happy to be here.
Yeah, let's get right into it. If you could just give us a quick background on
Sure.
yourself, and then we'll run through some questions here.
Absolutely. Would love to. So I'm a physical therapist. I've been a physical therapist since 2009. Graduated from Texas State University way back in the day when it was still a master's program. And I went into sort of a typical outpatient orthopedic private practice right after school and really enjoyed, especially patients with any kind of spine problems, so low back pain, pelvic girdle pain. And I kind of stumbled my way into also treating a lot of pregnant patients who had low back pain and pelvic girdle pain. I was very lucky in that I had a wonderful mentor right out of school who taught me a lot of the things that he knew, and he had just happened to develop that sort of it was thought of as a niche practice at the time. Not most outpatient orthotherapists did not offer that care, and so I was very lucky to be able to learn that under him. And so I just really, again, loved the spine, loved the hips, loved the pelvis. And it was sort of a somewhat natural progression. I know we'll talk more about exactly how I got into pelvic health later. But when I did add pelvic health to my practice, one thing that I really realized that I hadn't expected was that pelvic health is really just the next level of musculoskeletal care for many of those patient types. And so it was just kind of natural for me to start learning more about that. And then also at that time, there just weren't a whole lot of educational opportunities for people, especially people who really wanted to marry the worlds of pelvic health and orthopedics. And so I was given the amazing opportunity to develop some educational content for that with Evidence in Motion. That was back in 2014. And we've been running that content ever since and have had a lot of just really amazing therapists come through. Both physical and occupational therapists actually have come through the content, and it's been a really fun journey so far.
Wow, that's amazing. Yeah. So, is there anything that you'd add to that inspired you to get into pelvic health as like a subspecialty?
Yeah, I mean, I joke that I was a very reluctant pelvic health therapist. I had very minimal exposure to it in school. I think like a lot of people even now. And what I did get was just enough to make me go, I am never interested in learning more about, like, it felt very foreign, it felt very other, very weird. And I was just like, I don't know what that is, but I don't really want to know. I'm doing outpatient ortho was sort of my mindset at the time. And then I had my oldest child and was sort of catapulted into this world of pelvic pain, pelvic dysfunction after having a baby. And I actually had to have a surgical repair about 5 months after he was born. So it was quite a very intense, I guess, introduction into that world. And came to find out after I had surgery that the closest physical therapist who could provide care to me was 2 hours away from where I lived. Not exactly a doable thing for me as a new mom who was working full time in a clinic myself. So honestly, I went to my first pelvic floor class and I don't necessarily know that I was really truly planning to treat patients. I really went to learn how to help myself get better. And
Mm.
then I walked out of that class and after the class, people said, "Oh, how did it go? How was it?" And I said, "I'm very excited and I'm also very mad." And I was excited because I realized that this is an iteration of musculoskeletal care. This is the missing piece that has been bugging me for so long with like some of my frequent flyers, the people with, the SI joint pain that just come back every on a cycle and why don't they stay better? And I had been blaming, well, they must have stopped doing their home exercises. That wasn't the reason.
Mhm.
They had a component that wasn't addressed fully. And I was upset because at that point I had done an orthopedic residency. I had done a lot of continuing education courses specific to developing my skills in the in the spine, in the pelvis, in the hips, and just that entire region. Did not know anything about the pelvic floor muscles until the point of that course, even though those muscles are integral to the support system for the previously named structures. So I dived in wholeheartedly and was very excited to be able to marry the orthopedic skill that I had already developed in my career to that point with this new skill set.
Hmm. Yeah, I hear that a lot with clinicians that specialize in pelvic health. That it was oftentimes it's from females, and it's born out of a genuine need that they have first themselves. Once they
Mhm.
realize the fact that there's not, I mean, this is probably even amplified 10 years ago, right? But not a level of access to that specialty
Yep.
as there is others. It's like, wow, there's a real opportunity here to help a lot of people. And that's exactly the type of things that we're trying to get out of these interviews, you know? So is it safe to say then that that was another reason why is just a lack of overall, you know, care
Absolutely.
options?
When
Yeah.
I trained, there were a total of 4 physical therapists in the state of Missouri, which is where I live, that provided pelvic health services. Now
Wow.
there are many more, but I will tell you the entire time that I was treating patients full time in the clinic for my practice eventually evolved to become almost entirely pelvic health because there was so much need and I was one of only a
Mhm.
few people who could do it. And it was not uncommon at all for people to drive multiple hours one way to come see me. I had
Wow.
people who got on planes sometimes to come see me because either they couldn't find someone who was closer, or the one person maybe that was a little bit closer, that just wasn't a fit for whatever reason, or didn't take their insurance, or whatever the case might have been. And so, yeah, there is a definite need. And it's funny because I often will have people reach out and say, "Hey, I'm potentially interested in starting a pelvic health program within my practice. Do you think I can get enough patients because I live in a town of X size?" And I always laugh a little bit because I also live and have practiced, my entire pelvic health career has been practiced in a town of about, I'd say the population is about 90,000, plus there's a student population that's kind of transient. So with the students, maybe 115,000. And I found myself very quickly in the situation of needing to recruit and train additional therapists because I had a waiting list that was, I mean, weeks to months long. And
Mhm.
so, now there are 13 total therapists who primarily practice pelvic health within the university healthcare system, where I sort of started that program, and they're all busy and they all have wait lists. So I'm like, there's no lack of patients. That's not going to be the problem. The problem is going to be, how do you take care of all the people who reach out with a need?
Yep, and I can see that too. I mean, I go to conventions and trade shows all the time on, you know, in the world of physical therapy and occupational therapy, and everyone I talk to who's got a pelvic health specialization says the same thing. They started it thinking it was just going to be a component of their practice, and it ended up taking over
Yep.
because of the need. It's
Yep.
amazing. So,
Absolutely.
so before we talk about EIM's, you know, offerings under the pelvic health umbrella, can you share with us one of your most inspiring patient stories about how
Yeah.
you realize this, you know, knowledge and these skills you obtained, you know, help change literally someone's life?
Absolutely. This is actually one of my favorite stories to tell. Um, so I was at the point where actually probably all of my practice at this point had morphed into being public health. And I had come in on my day off to cover for one of my colleagues who was an orthopedic clinician because he was ill suddenly and I was available. So I came in to cover his caseload for that day. And I was looking through his caseload and I saw I had 2 evals, and one of them was a patient with knee pain. And I got all kinds of excited because I had not, at this point, I had not done a knee eval in, my goodness, probably 5 or 6 years. So I was like, oh, this will be so fun. I haven't gotten to do these tests in a while. So this lady comes in and I'm talking to her and she's just kind of all over the place. One of those patients where it's really hard to pin down their complaint, really hard to pin down their story, kind of wandering everywhere. And I start doing her exam, and I'm just not finding anything. This is an older lady, and just was complaining of generalized knee pain, but like no mechanism of injury, nothing real specific. So I start doing some screening. I'm not finding anything. But as I do this screening, I notice that her skin is really, really dry and it's tenting when I help her move her body, which, if anyone doesn't know, tenting just means you move the skin and it just stays in that position for a little while and then kind of goes back to its sort of relaxed state. And I'm sitting there going, oh my gosh, Jen, don't make this patient into a pelvic floor patient, because I had sort of developed this somewhat deserved reputation that I think there's a pelvic floor component to many of the things that we see in outpatient practice. And so I was making fun of myself. I was like, you're going to turn the knee eval into a pelvic eval. Okay. But so then I was just like, all right, I have to ask you some questions. How much water do you drink every day? Which is not something I would have asked a patient with knee pain prior to my pelvic training. And she says, oh, I keep it to 6 to 8 ounces max. And I thought I misheard her. I was like, do you mean 60 to 80 ounces? No, she meant 6 to 8 ounces. Well, tell me more about that. Why are you doing that? And she says, oh, several months ago, I developed this condition where the lining of my bladder became eroded, which is a thing that can happen to people for a number of different reasons. And I was put on this medication that was supposed to fix it, and it didn't fix it. And the symptom of that is that people have to go to the bathroom all the time, like every several minutes. And so she's like, and it's not repairing. I've been on this medication for months. We've changed medications a couple of times. Nothing's working. And I am, kind of desperate, and I can't spend my whole life in the bathroom for multiple months. So I just quit drinking so that I wouldn't have to go to the bathroom as often, but it isn't working, which is a very, very common thing we hear, by the way, because people just naturally assume, oh, if I have to go to the bathroom a lot, I should just drink less and then I won't go to the bathroom as often. And I said, okay, well, I'm not finding anything specific to your knee. However, one thing that I do know is that when you don't drink enough, and 6 to 8 ounces is not nearly enough, what can happen is that it actually concentrates your urine. It makes it very, very strong, which can create a very acidic environment inside your bladder that may be what's contributing to that lining not healing. And dehydration can also cause things like brain fog, mental confusion, joint aches, joint pains. So, what would you think about trying to do a plan where we try to increase your fluid a little bit? And she was like, yeah, I'll do anything at this point. So, what I did for her that day was I gave her a plan to sort of slowly step up, because we weren't going to go from 6 ounces a day to 60 ounces, because then she would never trust me for anything. So, slowly step up the fluid over the next few days. And I also gave her a few just like generalized lower extremity strengthening exercises, just because I felt like I had to give her something for her legs, since that's what she came in for. And I said, come back and see me in a week. And I put her on my schedule for follow up, not my colleague's schedule, because I was like, this is going to be quite the explanation or whatever. So she comes back, and a week later, and I'm like, so how's it going? And she was, I'm not even joking, she was like a completely different person. She made more eye contact. It was like speaking to someone different. Her mental state was very different, much more alert, had a much better conversation with her, very on top of it. And she said, thank you so much. She had stopped her medication. Her bladder lining had healed in less than a week after starting to drink enough fluids. So that had gotten better. She was having no pain anywhere. Her skin looked completely different too, by the way. And the reason I like to tell this story is that that is not something I would have screened for at all prior to doing my pelvic health training, but it is something that has become sort of just baked into me, that like, I don't now, do I think every knee pain patient is being driven by the bladder or the pelvic floor? No. However, I do think that most therapists should probably learn a skill set of being able to screen for some of these things and at least rule them out. Just like how we would always want to rule out hip involvement in someone with some knee pain, because the pelvic floor is such a component of the core and stability system. I think it's pretty important for therapists to at least be able to be conversant about it and screen for it in patient types that you might not expect.
Yeah, that's a great story, and you actually just answered a few other questions that we had too. But wow, that's very powerful, and it really speaks to why a clinician should consider taking learning more about public health, and like you said, for nothing less, even just to obtain some of these other screening techniques, looking at things from a different angle, as you did in this case, ended up being extremely beneficial. Obviously, exactly what she needed. So. Um, that's amazing.
Yeah,
Very,
absolutely.
very, yeah. Well, so let's go into the EIM pelvic health course offerings. What's it
Sure.
like to attend a course? Well, first, can you briefly cover what offerings exist through EIM, and then
Yeah.
what it's like to attend maybe one of the courses?
Absolutely. So We actually have two different certification programs that people can take. We have the Certificate for Advanced Musculoskeletal Management of the Pelvic Girdle, which is a mouthful. But what that one is it's really designed for the clinician who says, I don't necessarily want to be a pelvic health therapist. I don't want to do internal work. I don't want to sort of put myself out there as the person to go see for things like incontinence or dyspareunia or pelvic pain. But I know that I'm seeing patients already because I hate to say this, people joke with me all the time that I turn everything into the pelvic floor. And I always just have to say, well, I didn't design the system. I'm not the one that made everyone have a pelvic floor, but all of your patients do have a pelvic floor. And so a lot of clinicians come to me and say, hey, I know that my patients likely have some contribution, or maybe the pelvic floor is the victim of what's going on with these other body parts. And I'd like to be able to cue exercise in a pelvic health informed way, or I'd like to be able to do some patient education on things like fluid intake and fiber intake and, help address my postoperative hip patients constipation and those kinds of things. And so I want to enhance the orthopedic clinical care that I'm already giving without necessarily kind of jumping in with both feet and becoming a pelvic health clinician. So that's what that certificate is designed for. Basically, you take all of the content that we have for pelvic health with the exception of the internal lab. So you learn all of the patient education pieces, you learn what drives things like incontinence and constipation, and you learn an external skill set that allows you to treat actually a lot of things in the clinic. I obviously have an internal skill set and I'm very comfortable with it. I don't pull it out all the time because not all patients need it. And so there are actually what people think of as pelvic health diagnoses that don't necessarily need internal work. And so when people go through that certification, they're qualified to take care of those patients. And then they're also qualified to know, oh, this is someone who does need pelvic health internally. Let's go ahead and refer you to somebody else. So that's the Certificate for Advanced Musculoskeletal Management of the Pelvic Girdle. And then our pelvic health specialist certificate is for the therapists who say, I do want to become what is sort of thought of traditionally as a pelvic health therapist. I want to be able to do internal work. I want to be the person that people send folks with incontinence and pelvic pain and pudendal neuralgia and constipation, all of these other issues too. And so that certification truly gives you a very comprehensive toolbox to treat all types of pelvic health dysfunction.
Mhm.
Um, One thing that I am really appreciative of with these certifications is that we are able to leverage the use of technology with on site learning both as a way to really help people get to a deep level of understanding of these topics. I mean, I remember training for pelvic health. It was a little bit like drinking from a fire hose because I didn't have a lot of background in it. So with the leveraging of the technology, we're able to deliver the didactic content in an online environment with faculty. So it's not that you're sitting there watching videos on your own. You are watching videos, but you're also having these in depth discussions with your classmates and with faculty. And we can spend a whole week on incontinence and a whole week on constipation, a whole week on pelvic organ prolapse. And so we're able to dive into the content with much more depth than just what would be possible in a weekend course, which is really great. And then when we come together for our weekend lab immersives, we're able to truly spend that whole time practicing techniques. So you get to repeat techniques multiple times. And we cover a lot of different a lot of ground as far as techniques go, everything from, of course, evaluation, but also how do you do soft tissue work? How do you do exercise cueing? What role do joint mobilizations and manipulations have to play? How do kind of the opposite of what we were talking about earlier, how do you screen for hip and spine and pelvic girdle components of this pelvic floor issue? So those are the two certifications. The two weekend courses, so the lab immersives, can also be taken just as standalone CE. So if someone said, this is very interesting and appealing, and I'd like to sort of dip my toes in the water, but I'm not sure if I'm really ready to commit to a certification, the Pelvic Health One course is all external, and it is designed to give people a toolbox for evaluation and treatment of pelvic floor components of musculoskeletal conditions that again is entirely external in nature. So that is where I always suggest people start if they're unsure, because even if you get into it and you go, yeah, this is good, this is all I really need, I don't want to go any more into detail with this, it still will give you a very comprehensive set of skills that you can then offer all of your other patients. And I know a number of people who have just taken that course, and they've said it has dramatically enhanced their care for their orthopedic caseload, and that they have become providers in their areas because their outcomes are superior.
Mhm. Wow. Well, it sounds like there's some excellent options from, yeah, from a shorter dip your toes in the water perspective, like you said, all the way up to a fully more specialized certification. So thank you for outlining all of that. Hopefully, all of our clinicians watching realize kind of an option for them. But now I want to focus with our last question on up and coming PTs, maybe, students or PTAs, anyone getting into the profession right now, or maybe a new PT. Jen, with years of experience in the PT space, what's one key piece of advice you would give to a new PT or up and coming PT?
Honestly, so one of my very favorite things to do in life and in my practice and in my roles has been mentoring, especially of new grads and folks who are newer to public health practice and the PT profession. And what I always tell them is it's okay if you don't know everything. I mean, my goodness, I remember graduating from physical therapy school and feeling like, oh no, I still don't know anything. And now I have a license. Like, I was actually a little bit scared in a way. And it's okay if you don't know everything. And it's okay to be honest with your patients that you don't know everything, but you're going to go look it up and just look at the PT profession as an opportunity to always continue your skill set. Even now that I'm at the point where I am actually teaching others, I often preface things that I teach with saying, this is what the evidence shows us right now. I reserve the right to completely change how and what I'm teaching in this area 5 years from now if some new studies come out. So, it's one of the things I love best about this profession is that we're constantly learning better ways to care for patients. We're constantly learning more about why the body responds to certain techniques the way that it does. And so, just realize that you're in for a lifetime of learning, and it's okay to not have all the answers immediately. None of us do.
Mhm. Yeah, that's a wonderful piece of advice. Thank you. Well, that's how we're going to conclude this interview today. Well, so thank you everyone who stuck around and watched with us. Jen, any parting words here as we sign off?
I think just know that it's okay to not want to do full wholehearted pelvic health, but do know that if you are treating patients in an orthopedic setting, you are treating patients who have a pelvic floor component, whether or not you're addressing that. And so that just knowing that there are options to learn how to take care of those folks. We had a study that came out just a couple of years ago that said 98% of people who identify as female have some kind of pelvic floor symptoms if they have chronic low back pain. I
Wow.
100% guarantee you that anyone in an outpatient clinic who treats women has seen patients in this category. And so just know that you are seeing these patients already. You actually know a lot more than you think you do that applies to the pelvic floor. And so, just taking those opportunities to learn how to take the skills you already have, apply them in a slightly kind of enhanced or elevated way can really make a huge difference in your patient outcomes and lives.
Mhm. That's a wonderful message to sign off with. Thank you. Yeah, I just also want to throw in one more thing from OPTP. Thanks again, everyone who stayed around for watching. For a lot of your equipment needs, definitely check out optp.com. If you're a professional, you can create an account if you don't already have one and get discounted pricing. And all sorts of products to take care of you, your patients, and of course your clinic as well. So, but thanks again, Jen, for joining us today. We appreciate everyone who stuck around watching. This is again our next level content education series in collaboration with Evidence in Motion. And this is Women's Health Month, and it is also Pelvic Pain Awareness Month, and that is why we're looking to put this topic in the spotlight here. And we hope you got a lot of useful knowledge out of it. So, Jen, thanks so much, and we'll see everyone next time.